you don't mind,
Please,
Barbara.
not at all, please.
Okay. So again, this is Black Video News. I'm your moderator, Dr. Mateen Diop, and we're having a very special town hall discussion tonight regarding COVID-19. And this edition is being sponsored by D2 Strong, District 2 Strong. Again, I'm your moderator, Dr. Mateen Diop, and we're going to have some very special guests with us tonight that you're going to hear from. So I'm going to take the time now to introduce some of them, and we'll introduce as we go along with the conversation. First, we have Representative Barbara Griffin Hawkins from Texas District 120. We have Commissioner Tommy Calvert from Bexar County Precinct 4. Councilwoman Jada Andrews Sullivan from San Antonio District 2. We have Chief Charles Hood from the San Antonio Fire Department. Dr. C. Junda Wu she's the medical director for the San Antonio Metropolitan Health District. Dr. Kenneth Kemp, a pulmonary disease specialist, Joint Base San Antonio at Fort Sam. And we have Assistant Chief Jay Hall with the Texas Division of Emergency Management. So the primary focus of this town hall episode is to provide updates, information, resources, and action items, especially related to the African American community during this COVID-19 pandemic. This health and safety episode is the first episode of hopefully many more to come as it relates to COVID-19 and the impact on the African American community. This series intends to disseminate important information to the African American community in San Antonio and Bexar County. Upcoming episodes will deal with the financial impacts for people and their families, businesses, churches, and nonprofits, along with resources, education, and youth and criminal justice aspects. This town hall series has been brought to you by D2 Strong, District 2 Strong, a group of community volunteers working to find ways to improve communication to our community, working to demand accountability and excellence and community engagement to strengthen our community through relationships with our elected officials and government representatives. We are facilitating today's town hall here at Black Video News Studio. We are proudly partnering with you, our community, to provide you with information you can use. Be sure to visit both D2 Strong and Black Video News on Facebook today. Again, today's episode is focusing on health and safety, updates and concern for our community. There are so many aspects of COVID-19 that we hope to address in upcoming town hall episodes, but we do have limited time. So our panelists today will keep their questions, responses, and updates framed within the focus of our community's health and safety. And remember, you can email us at info@townhall.black. We really wanted to get this information to you, so we did some fast coordinating to make this happen. With this first episode, we will learn what works and what doesn't work and improve on it in upcoming town halls. So I'm going to open up with our first panelist, Representative Barbara Griffin Hawkins, who represents the constituents of Texas District 120. Barbara, first of all, good evening. Thanks for joining us. And my first question to you is, I understand you saw a gap and a need to reach our community with information during this time, and then you reached out to the D2 Strong Committee to see if they would help. Kind of talk to us about how that whole conversation took place and how we're here today.
Well, Dr. Diop, I'd like to mention that we thought the deal had already started, and we were talking because we had believed the panelists, we believed it had already started through the announcements and everything, and we moved forward in the interest of time because the panelists do have limited time. So thank you again for that repeat for those people who got on late and who are just now, tuning in, because we have had some technical difficulties. But, rather than go into, a whole lot about what occurred, other than the community, when they expressed concerns, we wanted to reach out and bring in the subject matter experts to make sure that the community is well informed. So Chief Hall, Chief Hood, Dr. Wu, Councilwoman Sullivan have already spoken about the areas that of their concerns and issues. So we'd like to get more into the questions to the community on how we can help resolve some of their concerns or respond to some of their concerns. So again, our panelists have limited time. They're expected to check out about 8 o'clock. And then we wanted to stay on till 8:30 to have a debriefing. But what I'd like, again, is for our panelists, and it's my understanding Dr. Kemp came in as a guest and didn't come in as a speaker. So he's not available to speak unless he's online now. But I'd like us to move on the agenda a little faster so that we can get to the issues. Chief Hood has talked about River City nursing home that people had expressed concerns about. Chief Hall talked about PPE, which is his focus. And the thing I want everybody to understand is we all have a lane to ride in. And in those lanes, we have defined roles. Just like Chief Hall's role is strictly with PPE, Chief Hood's role is strictly in the fire, and Dr. Wu with the health department to really talk about the numbers, the statistics. And so I think we're ready to move on to Commissioner Calvert to let him weigh in on what's happening.
Absolutely. Thank you, Barbara.
Thank you, Representative Griffin Hawkins. We're really sorry. We're getting a lot of notes from folks who can't hear. I hope that the recording will at least be able to provide an audio rebroadcast of what happened. I think the most important thing is just to ensure that we have public trust in the process of testing, as well as in the domestic production of whatever reagents and things that we need to have as there's a shortage around the country. And of course, I know a lot of people are going through tremendous mental anguish just dealing with the fact that their life has been turned upside down. I was hoping Reverend Dr. Kemp would talk a little bit in his capacity as both a medical doctor and a pastor and a military man about that kind of issue. But I was really the wrap up. So I think, my big role tonight was to say it's probably all been said. And we've got a lot of work to do in terms of the public health process for our community. We are very much under attack, and I'm at work with my crew, and we're ramping up for the work ahead.
I think, Commissioner Calvert, one of the things we could ask Chief Hall is, as we are looking and the governor is talking about reopening, I won't get into that subject with him, but what type of PPE methods can we use during a reopening process? Chief Hall, can you weigh on a PPE during a reopening process?
Yes, ma'am, and a lot of it will depend on further executive orders and topics that come out of the governor's office. So I would defer to him, but I think it still is the same, is that once things start to open up, the social distancing is very critical. I mean, if a PPE is available to you, then you should obviously wear PPE out in the public, or if you're going to the grocery store or wherever you need to be where there's going to be a gathering of people. If PPE is available to you, and it should be, then you should wear it. If not, again, practice the social distancing of 6 feet so that you can keep yourself safe.
What do we do for those workers who can't work from home? I mean, we're worried about the nursing home workers who's coming back to the community. We're worried about, again, the food serving places. What can we do as citizens? What can we do more of?
I think the main thing is the citizen, for those, for example, if the restaurants start opening back up, and I'm talking about sit down and patio where you can actually go in and eat. Again, I'm going to preach this because this is what is one of the single biggest things you can do to help protect yourself and those workers is this: just keep your distance, keep that 6 foot social distance from them, and that way that'll keep them healthy. It'll keep you healthy. It will allow them to go back to work to earn a living wage to support their families, and move forward as this incident continues to go on.
And where can people get masks that don't have masks?
I can't speak for everybody, ma'am, but I know that some of these larger chains like H-E-B and Walmarts and stores of this nature have been providing some level of PPE to their employees as they become available. Again, the state has some PPE, but obviously it is very limited. And what we try to focus on, as Chief Hood said, is we want to protect those very, very critical healthcare workers, the doctors or nurses that are coming in contact daily with those COVID-19 positive patients. Our focus is to make sure they're protected first, and it's a tiered system. So as the first responders and everybody else gets their local personal protective equipment, then we will see about starting to get other personal protective equipment to those other levels, like the grocery stores and those types of restaurants. But again, I stress a lot of the PPE now is there is some of it available, and those local restaurants and those types of things are providing their workers with their own PPE.
Dr. Diop, you want to ask some additional questions?
I did. Can you talk about the wearing of scarves and are those good alternatives to the masks, Chief Hall?
That's a little bit outside of my lane. I would much prefer to defer that to one of the other esteemed doctors on the panel.
Yes, sir.
This is a personal opinion. I think something's better than nothing, but I surely don't want to answer or don't feel like I'm qualified to answer that one as opposed to some of the other people on the panel.
Yes, sir. Dr. Wu, can you weigh in on that?
I would love to also make a declaration requires everybody to wear a mask. Employers should be supplying their employees. You as an employee have a right to that. We would love to track if that's not happening. You can call our hotline 210-207-5779. Cloth masks. So if you're wearing them until they're moist, then, or if it's a scarf or something. So a lot of scarves, they don't have the fibers woven close enough together, right? But the most important thing is that you keep that distance. That's so much more powerful than whatever you put over your face. And a cloth mask, if you're wearing it until it's damp, there is one study that showed that people were actually more likely to get sick because that moist, damp area, bacteria and viruses will grow there. So with your cloth mask, you want to wash it after every day of use, and you want to change it or take it off so that it's not getting wet. And they're uncomfortable. So to the extent that you can do the 6 feet, that's better and more comfortable.
Okay, thank you. Commissioner Calvert, I did have one question for you. So today was the first day here in the county and the city that we were mandated to wear masks in public. Have you heard the citizens of San Antonio and Bexar County, or are we accepting it? How have you heard? What is your take on how that's rolled out today?
Well, I'm very concerned of the lack of state plan for proliferating masks in underserved communities. A lot of people are not necessarily tuning into the news, and there has to be more ways of reaching people than just expecting folks to do that. And so, I haven't heard a whole lot of feedback. I mean, there's plenty of people I've seen. I was in Lowe's this morning, and everybody was wearing a mask. The one on Austin Highway that I went to, but that's in between an affluent area of Terrell Hills and Alamo Heights and a poor area around Austin Highway. So that's not a good emblematic indication of the rest of the county. But there's no doubt that as we hit our apex here going forward, I've been concerned about the fact that a lot of the retailers have not protected their employees. I went to Academy a couple of weeks ago, like everybody trying to buy workout equipment because they can't go to the gym anymore. And in the process, I was kind of taken aback at the fact that the person bringing me my products, came up to my window. I popped the trunk so that they could put it in the trunk simply. And so anyway, we had contact, and there's going to be a lot of that happens. I suspect as these go back to regular life, reopening orders are going to endanger, I think, a lot of people going forward as companies are not ready, individuals are not ready for what's about to happen.
So are we seeing that the symptoms, are they still kind of roughly the same, resembling the flu or anything like that, Dr. Wu, or any of you that kind of have that information? Are we seeing these symptoms? Have they grown to be more serious, or are they still resembling a cold or a flu?
They do still resemble a cold, I guess, and it's cough, fever, shortness of breath. You don't usually have a runny nose, so that's a difference. And we're learning more about pre-symptomatic transmission, which means even before you have symptoms, being able to transmit the virus.
Chief Hood, you mentioned earlier about the nursing home situation, and I wasn't online. I could hear you. Can you kind of touch on that a little bit? Because I did have a question around the nursing home and what's the latest information there that you can share.
Why don't you ask me the question? I could probably answer that and give you the information.
Yes, sir. So I'm going what I hear on the news that the nursing home is kind of the epicenter of San Antonio, so to speak. Is it as grim as I hear about, or what is your take on it?
Well, I have an uncle in a nursing home. My uncle lived in that nursing home at Southeast several years ago, and probably nothing's really changed there. You have a lot of old people that live on the east side. They wanted to live there, and for what we
I lost Chief. Chief Hood, can you hear me? I'm sorry, I lost Chief. I'll come back to that question. Representative Hawkins, I want to kind of switch over to you and ask you a question.
Okay.
In our community, Representative Hawkins, you're always known as a beacon of hope. You inspire so many people. Is there a light at the end of the tunnel of this that you can see, and what you can kind of tell us today, what we can expect in the weeks and months to come?
I think there is a light at the end of the tunnel. I think that we have to take every challenge and turn it into an opportunity. One of the things that is happening is that people are getting closer together in terms of families. I'm seeing more families out walking. I'm hearing people talking, folks doing work that they wanted to do but hadn't had time. I believe that as we recover from this, what will happen is we will know life differently. As an educator like yourself, we thought distance learning was going to be impossible, but we're finding it works, and the kids love it, okay? And some of our teachers love it. It's also a way we can reach out to potentially dropout recovery kids or those that have children and can't come to school, and maybe we can do some distance learning support for them. So I'm very optimistic. No doubt I'm saddened by the number of people who are adversely impacted. I'm saddened by the number of deaths. I'm saddened by when folks are getting sick, and particularly African Americans at the high rate that we are. But I'm hopeful and I'm prayerful that indeed beyond this, we will be more united. We'll be working closer together. We'll communicate at a stronger level. And so I am immensely optimistic on what we can do.
So, Representative Hawkins, though, what do you see? You're also an educator, and you're one of the 9 hats that you wear. So, what do you see as the state of education moving forward? Now that schools are closed for the year, what do you see in the future for public education?
Well, I think one of it, Dr. Diop, is that we've got to rethink traditional public education. We've got to come into the 21st century in terms of introducing this new online format to our young people, because that's the world they live in. That's number one. I think the other part of it, because we know during the summer, and research shows that the learning loss that young people get during the summer is always devastating, and particularly to children of color. What I'd love to see happen is that we as a state, we as a local community, put together learning centers that will take place during the summer, be it schools that potentially can host learning centers, workforce development. So instead of having summer jobs now, I'd love to see our young people going to summer learning institutions and maybe even getting a stipend by attending, okay? So they get a stipend by attending. Can you imagine what the fall will look like for us in terms of when kids come back? They would have made a little money. They would have more creativity in their educational experience. So I really believe it will strengthen public education.
Thank you, ma'am. Commissioner Calvert, I want to kind of pivot back to you real quick as it relates to the county. I had a really good encounter with one of your deputy constables the other day, had this conversation about COVID-19. And I'm kind of wondering, do you have any angst amongst your county officers in particular, and what there is policing looking different for them, especially in the minority community?
You said angst? Do I have angst?
Yes.
Certainly. I have angst for my officers on the streets because they don't have the proper protective gear. I have angst for my officers in the detention center because the tag on the mask they had said not for areas where there's infectious disease. I certainly have angst for the community because in so many ways we feel under attack. So this is a very heavy time, as history will tell. It's a very, very heavy time, and there's a lot of unknowns, and there's just a lot of things that we haven't traversed before, but we just got to keep it in prayer.
So what are you going to do, Commissioner Calvert, with all of those issues you mentioned? I mean, what's the next step in your office?
Well, we're always on top of for communicating these issues to the county judge and the mayor, who are the chairs of the joint task force. And I think that over time, we're going to have to continue to get the people have the solutions far ahead of the politicians. That's one of the, that's just a matter of fact. And so we have to keep our ears to the ground in terms of solutions. But we're doing things like feeding seniors. We're feeding people at the Alamo Dome. We are responding when inequities are had in our community, when we are carrying up more of the burden than the Dominion or Stone Oak. And so we've been on top of it around every turn, and we'll continue to do so.
Dr. Webb, we have time for one more question I wanted to ask you. What is your medical opinion on why it's being reported that COVID-19 affects Black and brown citizens more than anybody else? What is your medical opinion there? Why is that happening, do you think?
It's because we don't all start at the same place. So if you already have, you're more likely to have high blood pressure, diabetes, other things that place you at greater risk. And, we can go into all the reasons that that's the case. It's structural, right? I mean, structural racism is a part of it. But this just amplifies the inequities that were already there before.
Thank you very much. Thank you all the panelists. We're going to have time right now. We're going to go to some questions from our viewers. So I have the staff here working to take those questions. So you want to go with the first question?
So, Dr. Wu, one of the questions is, what does asymptomatic mean? And if someone is asymptomatic, will they infect others?
I see the question in the chat box. So I can't give you numbers right now. I think that's still being studied. We can say that people who don't have symptoms, that's what asymptomatic means, are a lot less likely to infect people who are pre-symptomatic, and probably people who are pre-symptomatic in those few days before they get symptoms are less likely to infect somebody than somebody on the first day that they have symptoms. But I'd be lying if I said we had exact percentages.
Next question.
So,
where are we currently in the curve, Chief Hood? And when are we for Bexar County and San Antonio expected to hit our apex?
I can answer a lot of questions, but that's a Dr. Wu question.
Dr. Wu.
I wasn't expecting to be this popular. There are mathematical models that show us hitting it sometime around, next week to the beginning of May. I will caution people that when we hit the peak, that just means we're halfway through, right? So we still have the other half to go. So we're in this for the long haul.
Thanks, Dr. Wu.
Dr. Diop, Mayor Mary Dennis is on, and see if she want to weigh in on what's happening in Live Oak. a small city.
Oh, welcome, Mayor Dennis. How are you, ma'am? Do I have audio on Mayor Dennis? Barbara, I can't hear her. If you want to ask her a question,
I
you can
can't
but
hear
I
it.
can't hear her.
Yeah, no, me either. So,
Okay. Oh, she's muted. She's muted.
oh, okay, okay,
Okay, we'll take another question and we'll come back to the mayor.
yeah.
Okay, next question.
So, Chief Hood, can you tell us about where the locations of the testing treatment facilities are for our community, and what type of testing treatment facilities are there on the north side for this fight against COVID-19?
I'm not really understanding that question as far as a testing treatment site.
Testing.
Okay, so we're running a testing site at the Freeman Coliseum. There are other mechanisms to get testing, but as far as a drive-through testing site, it's the Freeman. This week, sometimes we will be opening up testing at Walmart. One location, Dr. Wu may have that information. Texas Med Clinic is another way for you to get testing. And so if there are people out there that they cannot make it to testing for whatever reason, they're not ambulatory, they're having vehicle issues, you can call the COVID hotline and we could screen you and then try to figure out the best way to get you tested.
Thank you so much. So I don't have someone on the line who can answer this, but we know that in order to re-engage properly, testing is an important part of that, not making sure that we don't go back into a huge second wave. And so I don't know if we have anybody who can answer on whether or not the state is planning on using its buying power to purchase tests, or are they going to tap into federal dollars for that? And also, does the state of Texas have any plans for employing tracers to help with those who have been in contact with a COVID-19 person as we reach our apex and re-enter back to the workplace?
Well, I can help with that, and anybody else can jump in. But the governor is seeking to get more tests done. I think everybody realized that testing has to be ramped up. And so that is an effort that we're all, from the Texas Legislative Black Caucus to the entire state legislators, we're asking for more testing to occur. So we believe that'll be coming online in the next week or so. We're also looking at what can we do to improve what the state of Texas is doing. The resources are there, be it from the federal level, the state rainy day fund. We have the resources to make those things happen. What we need right now, though, is the advocacy. We need folks to start emailing, calling their state legislators and their state senators, really asking for that. And one thing I want to add to the political realm is that the squeaky wheel gets the grease, and we have got to get to the powers to be to make sure that they know that this is important to us. And so, yes, will the state do more testing? Yes. Hopefully in the next week or so, we'll see more. But in terms of the tracers, I have not heard that conversation. But the governor's got some public announcements that he's going to continue to make. But I want y'all to know behind the scenes, the state reps are working very, very hard and sending out letters, the reps as well as the senators, sending out letters to the governor, being that voice for the community. So we're working on those issues.
Speaking of being the voice for the community, we have a lot of joint task force being formed right now with different aspects of COVID-19, including us re-engaging. But do you find that we have enough representation from our community to represent the minority voice on these different task forces? And if we don't see it, what should we do?
Well, I think you've seen the 5 names that were mentioned to be on the governor's task force, and no, they were not representative of the minority community. But I think that what we've got to do is get back to contacting our elected officials and making sure that our voices are heard, and making sure that, and not just at the state level, but the local level too, because a lot of it is driven by what the local level does. And I think Chief Hood could weigh in that the mayor, the county commissioner have been working tirelessly on trying to make things happen. And I think as they're hearing what the people want and need, they're sharing that with the state. But it's my understanding under the whole emergency management operation, that task force is working. And Chief Hood, I believe you're a member of it, is working to make some things happen. Is that true?
Yes, ma'am. I'm part of the Unified Command, which is managing the incident. We're very fortunate that the state emergency manager, who is Chief Nim Kidd, used to be a San Antonio firefighter. So several of the members that are up at the state emergency operations center used to work in San Antonio. We have an amazing relationship with the state as far as getting resources. The Freeman Test Center is called a platinum system. It's one of the finest in the country. FEMA reps came out and looked at that, and they sent guidelines and recommendations for what we were doing here. We've been very proactive in getting PPE equipment, in setting up facilities at the Freeman as far as the surge capacity. This is all because of the relationship with the state and the hard work of our from our governor, that he's been getting information or input from the judge, the mayor, who we brief every single day on what's going on. So as far as resources, Houston, Dallas, the Metroplex areas, they don't have the resources that we get, and we get them first. So as far as the management of this incident, again, we didn't have a playbook, but and we're already starting our after action review to see how we've done, because we started out so far. I have confidence that when this is over with, people look back and say it was successfully managed.
Thank you, Chief Hood. I also want to thank Chief Hall, because he has to go and get on another call, but I want to also thank him from the state for being here and helping us understand the PPE issue. So thanks, Chief Hall.
Thanks, Chief.
Hey, ma'am, I appreciate that. And if you ever need me back on one of these calls, I'll be glad to do it. And understand that I see Chief Hood probably a couple of times a week at the EOC, so I'm right there with him.
Great. Thank you, sir.
I have a question
Joy,
for
I wanted to,
Councilwoman Sullivan.
Joy, I wanted to answer that question about the task force, because one thing that I've been given the opportunity to do is serve as co-chair with Commissioner Justin Rodriguez when it relates to food security and shelter. And so when we started forming these task force, we're able to bring in advisors. So I've reached out to a lot of the individuals I know, such as Mr. Willie Mitchell, to help bring him on under contracting to assist us with the after action for going back into sheltering and finding proper facilities if we have to start from ground up for affordable housing and what that looks like. When it came to the physicians and the medical task force, I specifically asked our mayor if there was a Black doctor on that task force to help to truly talk about exactly what is going on here within the African American community and how it relates to COVID. Can we do more? There's so much more that we can do. And each and every last one of these task force will be reaching out to the community to find out exactly who else can we implement in these task force to make sure that everyone is fully represented.
Thank you.
I have a question for Councilwoman Sullivan, if I could. Councilwoman, the questions asked for you. One of the viewers asked, what resources are available for small businesses?
So the resources that were available for small business under the SBA, those have run out. However, we still have funding under the LIFT fund. And so what we're doing right now through the city is we're looking to bring SAGE on board to be an advocate for those LIFT fund dollars here within the community. They have an eye and an ear on exactly what the businesses here in our community need. And so SAGE will be coming on board. They'll be having a conversation with myself coming the next week in reference to how do we bring Sage and Lift Fund together to be that financial advocate for our small businesses. Also, we're asking all of our small businesses to please reach out to us so that we can continue to drive business their way. We need all of our businesses open within our district. If they can do any kind of curbside business, any kind of delivery business, we need each and every last one of them to be available to us so we can send everyone to them as well.
Well, those
Comment on that question of small business, if I could, real quickly.
Yes, please.
We've had a lot of complaints from the African American community about not being included in the decision making at Lyft. We do need to audit those records. We need to make sure that they have loan officers who are from the community, can outreach to the community and provide credit awareness for the community. And I also think it needs to be emblematic of every quadrant of the community, because every quadrant puts in public dollars. In the case of the county, $5.25 million of every taxpayer's dollars were put into that. And if we don't see that kind of return in every part of town, then we need to perhaps put stronger regulations and manage it under another auspices. The other thing that's available primarily is the Small Business Administration. They are going to have a probably another $250 billion or more in aid that goes out, this time to smaller banks. Those smaller banks are probably more in line with most small business people bank with. And that way the big boys like the Ruth's Chris and the Shake Shack, who have friends that are connected and powerful, that they are not the ones swallowing up all of the money. And so we have to do a better job as Black elected officials to ensure equality, equity, and the return of every taxpayer's dollar to every taxpayer.
My question to the councilwoman, in terms of the Lyft funds, will those be grants or will those be loans, or y'all haven't decided yet?
So we have two different areas. We do have some grants, we do have some loans, and then we have some forgivable loans as well. And so as we continue to go forward, the reason why I'm asking for Sage to be an advocate within the community is because a lot of the owners that we know in our community are not able to leave their businesses and go over to another area of town to get Lyft Fund. And so we need someone that's here that can be boots on the ground, going to these businesses where these owners are actually working, taking them the paperwork, making sure they understand how to fill it out properly, making sure that all their documents are in line. So this is how we continue to build our businesses. Before all of COVID happened and we were in Washington, we were pushing and advocating for smaller businesses not to have to go through all of the red tape that larger corporations go through to get their hands on capital funding. And so now that we're at this point, it's truly looking at exactly where do we have those that can step up to reach out to those smaller businesses that have owners that are hands-on to make sure that everybody is a part of this conversation.
Chief Hood, I have this next question for you. The caller asked, how is testing scheduled to be implemented on the state, I guess here on the local level? How does one go about getting tested at the Freeman Coliseum that you mentioned?
Unmute your phone, Chief. Unmute your phone.
I'm going to let Dr. Wu answer that. She's ready for it.
Call
Okay,
210.
Go
210.
ahead, Doc.
210-233-5970. That's the number you call to get tested.
So to get tested, area code 210-233-5970. Is there a cost to that?
Private clinics that can test you. Dr. Wu, could you talk about that as well?
Sure. So we would love to conserve those free tests at Freeman for people who don't have other resources. And there are lots of private doctors now, as well as our safety net clinics like CentralMed and Communicare doing that on a smaller scale. Some of the bigger places were already mentioned, like Texas Med Clinic, but they're not the only ones. So check around.
Okay. Commissioner Calvin, I guess this would probably fall on you. The caller asked, the spread in the jail is due to guards not taking this serious. What are we doing about the inmates' health and safety, as well as what the community is seeing that guards go home, shop in stores, and things like that?
Well, there that must be someone who works at the jail. I don't have any insight into that personally, but that could be true. There are definitely elements of our society that have been noted as not caring. I can't say that as a blanket statement, but it can't be ruled out. But I also think it's in part a managerial issue, because as the outbreak was happening in the jail, it seemed to me that there should have been a very swift and very a very complete testing of the folks who were in the jail and the guards, rather than a kind of after the fact triaging. I mean, we've seen in Iran, for example, them having to let the whole jail go because it got out of control. And so, there's systematic failures in terms of testing and in terms of quarantining and triage. There are probably attitudinal failures, and that will come to light later on.
Okay. You have any more questions? Okay, go ahead.
Okay. So certainly, we are very, very grateful to our healthcare workers and to essential workers, first responders. And we understand that it's a tough world as they're serving now. We really appreciate them. However, we've seen some sad stories across the nation and right here locally where there has been infection from those caregivers or healthcare workers. They go home and potentially infect their families, or they have to find ways to separate themselves. So it's our understanding that there's currently a program where there is 800 hotel rooms that are available right now via the city-county agreement, and they're not really being used. And the only way that you can use them is if you have tested positive. But wouldn't it be nice, since they're not being greatly used, if we could have them open to those workers that are afraid to go home and possibly infect their family to use those? So could we have a conversation about how we could open that up? I'm not sure if that would be Chief Hood or who that would go to.
I'll jump all over that. That's one of the areas that we're responsible for. They're called isolation care facilities. And we have about 840 rooms. We have one hotel that is for first responders and public health employees. We have another one that is a step down for hospitals if we need it. We have another one that's for general population. So I had a firefighter that just got out last week because his girlfriend was COVID positive. They lived together. So he went and isolated for 14 days, and thank goodness he wasn't positive. But we have challenges as far as first responders. You know, we are fighting something that's completely invisible. We have spent an inordinate amount of money and developed guidelines and everything that you could do to make sure that our folks are safe, because we are the tip of the spear. But I have a station right now where I have 5 members that are positive. And again, they probably contracted it from a patient. We live in a fire station for 24 hours. It's very difficult to do social spacing, and we're trying to do that. It's very difficult when you're riding in an ambulance next to someone or in a fire truck. There is not 6 feet. And then when you're fighting fires or taking care of someone, we get close to each other. So we take temperatures 3 times a day. So my members that were testing positive, they were found because they had a temperature at the middle of their shift. And so we have surveillance measurements in place to try to identify our firefighters to make sure that they are not contaminating their crew members or taking it home to their loved ones. So we have advised all of our firefighters to create an isolation room at your home. Or if you go to one of these isolation care facilities, it's available to you, whether you're law enforcement, any of the ESDs, the fire departments, any of the healthcare workers. they can use these isolation care facilities. There's one thing to that though. You don't get a key. You can't leave. We'll provide food for you 3 times a day, or you can order DoorDash, Uber Eats, and get that brought up to you. We'll have like a concierge service to get you the things that you need as far as hygienics, cleaning, things like that, but you can't leave. So the idea when we say isolation, it's 14 days of isolation, but we have facilities available. If there's someone in the public that needs an isolation care facility, they can call the COVID hotline or 211 or 311, and there's going to be somebody there that can screen you and identify if you truly need to go to a facility and then give you the parameters. Believe it or not, when we give people the parameters that they can't smoke, they can't drink, they can't have people there, a lot of them choose to find other places to isolate.
Well, we want to thank everybody for coming out today and listening to our panelists, and we want to save some time for them to kind of give us some closing comments. So since Chief Hood, you were going really good there, I'm going to start with you. Just kind of, what can you leave the audience with today? Just real quick, what can you, I'm hoping, give us something to look forward to. Chief, I'm going to put it on you right now.
You know what? I want you to look forward to this being over one day. And I'm like each and every one of you. I miss my family. I miss my kids. I miss doing the things that I am used to doing. But staying away from people right now and being a little uncomfortable in isolation is going to help us down the road so we don't see those huge spikes of people dying in our hospitals surging. So do the right thing. Take care of yourself. Enjoy this isolation time. Pick up a hobby. But we'll be back and we'll be stronger. But it takes each and every one of you to do your part to help us do ours. God bless. Thank you.
Thanks, Chief. Dr. Wu, what can you leave us with?
I think sometimes people think that this is health against business, and that's not the case. We want people to go back to work and have businesses open too. We know that, I mean, there's the health that you put at risk from getting an infection, but also if you're poor, if you're broke, that puts your health at risk too. We get that. We want people to get back to regular life in a safe way. So I second everything that the chief said and know that we're working for that too.
Thanks, Dr. Wu. Councilwoman Sullivan, what can you leave us with?
Thank you so much, Dr. Dia. You know, this is one of those times where we truly means coming together, not one of us, not 2 of us, but all of us. And so as we, as the city of San Antonio, continue to push forward, as we continue to strive and grow and become that united front for the rest of the world to truly start using the models that we are using here across the globe, we have to continue to do our part. I know there's a lot of work, there are a lot of concerns, and as we go forward, we ask our community to continue to call, continue to send us their photos, continue to reach out to us about their concerns. We know they have concerns about the homeless population. We know they have concerns about those that are needing to be in these isolation facilities. We will continue to do the work and have these hard conversations about things that we have never in our lives seen before. So as we go forward, we ask that they continue to be kind to one another, continue to be calm, and continue to be compassionate, because that is what it's going to take for all of us to get to the new norm that we're going to know. But at the same token, know that we're here to do the work. And as hard as the work will be for some of us to find those resources for those that have been long forgotten, we will continue to fight for that. And that's what they need to understand. We are not going to just no longer sit by the sidelines, but now is the time to step up and get our just due, because we have to do the things that have not been done before. Thank you.
Thank you, Councilwoman. Commissioner Calvert, what do you have for us, sir?
Well, you know, history repeats itself, and certainly we are in another biblical time. And so what I ask folks to do is just pray for the country, pray for the leadership, that they would do the right thing, because there's a lot of mistakes that are being made. And we know the Holy Spirit has the ability to change these things and make them right.
Thank you, Commissioner Calvert. Representative Griffin Hawkins, what can you leave the community with?
Well, I want to start with an announcement. The governor announced today that he's going to mobilize 1,200 National Guard to work on trying to get the testing up. And because I know that's a big question, so people can have the confidence to get back to work. He's going to start in Fredericksburg and Floresville to start setting up where the National Guard can mobilize, and he'd like to at least do 150 tests a day. I think, we hear a lot of the rhetoric on the national level that uh, folks want to open up, but I think everyone, regardless of party, know that the reopening process starts with increasing our testing so that people can have confidence that we're identifying hotspots, we're identifying the real numbers of who are positive. And I think folks have shown that they're willing to take the precautions at your HEBs, at other places. People are doing a lot of what they need to do. Most people, I won't say all, but what I like to leave the community with is concur with our councilwoman and our commissioner. Number one, pray, recognizing that God Almighty will help us through this, but also as our councilwoman say, stay engaged. Let's hear your voices. Let's hear your concerns. Let's stop being victims and let's educate ourselves on what's going on, communicate with one another, and be well informed so that we're not giving what I call the boogeyman stories, but we're indeed on the right track in terms of things that we want to do. So, Dr. Dia, I thank you and all that you do as a born raised San Antonian, and what you've done in education and the role model that you have established. I think people are able to see that more in our downtime, and we begin to recognize our local heroes, one like yourself, who can help us through this difficult time. So thank you so much.
Thank you, ma'am. And I want to thank everybody for coming in today. I hope I didn't miss anybody, but I just wanted to leave you with this. It's basically a statement from Black Video News. Don't become numb. Please keep up your vigilance and social distancing during the COVID-19 apex during the month of May. It's not just about protecting yourself, it's also about being a decent, caring human being, treating others as you would want to be treated. You don't want anyone knowingly or unknowingly infecting you or yours, so why put